Police in Oklahoma City are responding to a soaring number of mental health calls. Why? And what actions are police taking when they arrive on the scene? And what can be done to produce better outcomes statewide? That's the focus of a recent collaboration between our content partners, Oklahoma Watch and State Impact Oklahoma. We are joined by reporter Whitney Bryen of Oklahoma Watch and reporter Quinton Chandler with State Impact Oklahoma. Thanks to you both. Whitney, let's begin with the why. What's behind the increase in these mental health calls?
What we discovered was over the past 10 years or so, state budget deficits have led to fewer dollars going into the state's Department of Mental Health and Substance Abuse Services. So there are fewer services available for folks. And what happens then is they have to prioritize who gets help because the money is low. So they always prioritize, the highest level of needed care, those people who are in crisis, which means people who need preventative care, maintenance care, just daily check-ins. Those people are getting fewer services, and then they end up going to crisis as well.
Quinton, you and Whitney produced a 3-part series. What were your goals setting out?
Going more in depth on how these calls affect police, going more in depth on how they, what kind of toll they take on the people who end up either in police custody or just, having police respond and releasing them.
Police receive lots of training, but how much training for this?
Oklahoma law only requires police academies to provide up to 4 hours of mental health related training to police officers, but different departments can set their own standards. Oklahoma City Police, for example, had 16 hours of mental health training that they required of their officers.
There's been a big national discussion about taking some of these responsibilities away from police and giving them to people perhaps better trained to do it. Tell us what the pros and cons of that might be.
Well, police, as you said, don't receive a lot of training in mental health. And even if you receive the specialized training for mental health that's optional for police officers, that's called CIT or crisis intervention training, that's a total of 40 hours. So in comparison to folks who are licensed mental health professionals, you're right, it's not very much. Police are trained to deal with people who are breaking the law, people who are violent, people who are dangerous. So those are some of the biggest benefits of removing police from that situation. In fact, we found that people with a mental illness are at a much higher risk, 16 times higher, of being killed by police officers than people without mental illness. So there's some big benefits there. The cons, however, of removing police from these situations is sometimes these folks can be dangerous. Sometimes they can be violent.
Quinton, so let's talk about solutions. In the course of your reporting, what did you discover? What can be done to get better outcomes?
The Oklahoma City Police Department, for example, just this year rolled out a system where they basically have an iPad in the police cruiser, and if they encounter somebody on a call who is dealing with some mental health condition, they can hand over that iPad, tap an app on the screen, and get help from a mental health professional, someone who's an actual counselor, an actual therapist who does this for a living. And that person can kind of walk through what's going on. So there's lots of different things that the state can do and that the Department of Mental Health is looking at. It just, those things would cost money.
Investments, funding. So that brings us to the legislature and what possible role they would have.
In Oklahoma, our state law requires that police respond to people in a mental health emergency. So at this point, we don't have the option to send mental health experts in lieu of police. Police have to be involved. So that's number one. Number two, I would say, is police training, right? Again, this is where the legislature could come in and maybe require additional training for police officers.
Yeah, it's always hard to predict what the legislature is willing to do. Mental health, it has been a big topic in the legislature over the past few years, but this is going to, some of the things that have been proposed are going to cost money, and the state is looking at a fiscal crisis right now. Whitney and I really enjoyed working on these together, and we're looking to continue working on this subject. So please stay tuned for what else we find.
Tremendous work by both of you. Thank you very much.
Thank you.
Thanks, Rich.
And if you wish to read the three-part series in its entirety, you can find it in two places, oklahomawatch.org or stateimpact.npr.org.